All right. Well, just to be respectful of everybody's time, we will go ahead and get rocking and rolling. Um, if everybody can mute their phone, it looks like most folks are, or their Zoom, that'd be best. And then as we go through, if you'd like to enter any questions, you can in the chat, or we'll have a Q&A, open Q&A at the end as well. But I appreciate you being here today. If we haven't had the opportunity to meet, my name is Craig Tolson, and I'm the CEO of the Home Builders Association of Virginia. And today we're going to be talking about the exciting announcement that the Home Builders Association of Virginia has joined the WiseChoice Healthcare Alliance. It's an amazing member benefit that we're rolling out. It's something that our members have been asking for years and years and years about, why doesn't the association have an association healthcare plan? We need access to additional resources to reduce our health insurance costs and plans because, as we do know, there are only so many carriers out there and options for health insurance in Virginia. And we're hoping that this new tool is going to be something that one adds, produces your bottom line, adds great benefit to yourself and your employees for your health insurance, and then just really ties you back to the association even more to say, wow, it's a great value and something that you can talk about to others about why they should participate with the Home Builders Association in the state. So today we are going to hear from Ritter Jonas, who is with One Digital Health and Benefits, and Tracy Langston, who is with Anthem. The WiseChoice Healthcare Alliance is part of the Anthem plan and umbrella, so we're excited to have Tracy here to explain all the ins and outs of that. Um, Ritter is our endorsed agent here at the association. Ritter works with our association members, yes, on health insurance, but really on their overall benefits plan, their goals to make sure they're all being achieved and really helps them keep themselves competitive in the marketplace within the industry. As you know, each different industries offer different benefit packages and different levels of service. So make sure that our members are staying on par with their competitors as everybody's trying to attract and retain employees in this competitive market that we're in. So with that, I just want to say thank you for being here today. We are going to be recording this and distributing it to our members and to other local associations. So as you ask questions, just know that we are going to be recording this. I really do encourage you to ask questions because someone else may have the question down the road. So don't be shy. And we have basically an hour scheduled for this. So at this point, I'm going to turn it over to Ritter to get the program started. Ritter?
All right. Thank you, Craig. And thank you all for joining today. As Craig mentioned, we're excited about being able to offer this to the Home Builders Association of Virginia members. It's a great member benefit, and we think it is definitely worth exploring, all members exploring this at their next renewal for an opportunity to potentially save, 20%. Now, we'll talk a little bit about the underwriting today, just to give you kind of an overview, as Craig mentioned. I'm with One Digital, but I represent HBAV Insurance Agency. And so I'm here to help members with anything around employee benefits and human resources. So we have, we can help you with health insurance, dental, life, disability. We also have HR consulting. And so, if you have any needs around any of those, please feel free to reach out. Today, what my goal is just to give you, I'm not going to go too far in the weeds on the plan, but I want to give you an overview of the opportunity that we have. So as Craig mentioned, please raise your hand, come off mute if you have questions, and then we will have a dedicated Q&A time at the end. So with that, let me share my screen. I've got a presentation prepared, and we'll send this out to everybody, afterward as well. So this plan has been the work of the Chamber of Commerce, the Virginia Chamber of Commerce. So they worked with Anthem over the last, year and a half, 2 years, to really kind of work to develop this as an opportunity for chamber members around the state. But as part of this, it's called the WiseChoice Healthcare Alliance. So trade associations can opt in to be an alliance member. And so by that, you have access to the same plans. You don't have to be a member of the Chamber of Commerce. We'll talk a little bit more about that, but it's a collective of it's not just for Home Builders Association of Virginia members. It is for chamber members, and there's quite a few other trade associations that are all participating. Really, with that, let's talk a little bit about the goal. So the goal of this plan was really to have a collective of businesses and community leaders that join together to help Virginians drive healthcare engagement and health literacy that will lead to improved long-term health and in turn lower healthcare costs. So gathering all the businesses, and this is for small businesses under 50 employees, but gathering all of these small businesses together in a self-funded format, but having the protections of being in a much larger group, the economies of scale, to really lower healthcare costs and drive better long-term outcomes for the groups. And so, like I said, we recommend everybody kind of exploring this at your next renewal, just to see if it would be a good fit. It is going to be based on your health status, which we'll talk about in the underwriting, section, but definitely worth exploring. So some of the key details around this plan, again, as I mentioned, created by the Virginia Chamber of Commerce for the purpose of offering employer-based group health insurance to members of local chambers and associations. HBAV joined as an alliance member for this. It is a self-funded employee welfare plan for employers with 2 to 50 employees. So that is, you do have to have, we'll talk in the underwriting section about the minimums, but you do have to have at least 2 employees participating. So unfortunately, with this, it's not going to be applicable for anybody that's a sole proprietor that does not have another employee. You have to have at least 2 individuals that are participating in your health insurance. It is not just one plan that you're taking advantage of. Think about this as just the funding arrangement behind the scenes. So how you're paying your premium, the stop loss insurance that's included, but you have a full portfolio of plans to consider. So what we often find is that whatever type of plan you're on currently, we can match you up to something pretty close within the WiseChoice Healthcare Alliance portfolio of plans. As you'll see on the screen, there's 146 different plan options, both on the KeyCare PPO network and the HealthKeepers open access point of service network. Now, depending upon where you are in the state, and if you have employees that are maybe across into West Virginia, you may want the KeyCare. If you're in the middle of the state, HealthKeepers often is a suitable network for you because it has 95 or almost 96% of the same providers in the HealthKeepers network that are in the full PPO network. So, and it's typically about 10 to 12% less expensive for the HealthKeepers network. But with that being said, you have a full portfolio of both traditional plans, ones that have copays for primary care and specialist and pharmacy, all the way up to the higher deductible HSA qualified plans or health savings account eligible plans. So you'll be able to find a plan that fits your needs on an individual group basis within the portfolio. You are part of a larger, if you join this, you are part of a larger self-funded group. So with that being said it's going to be based on health status going in, but you'll see as part of this group, you're going to be sharing in the overall claims risk and also sharing the cost for the financial protections. So stop loss insurance is a type of financial protection that can be done on an individual group basis, but typically it's one of the more expensive features or plan components when you are self-funded, because it is protections on the higher end. So if your claims exceed a certain point, a stop loss carrier, it's a secondary version of, basically layered insurance. The stop loss carrier would take the amount above that designated, what we call attachment point. Because of the expense there, it's good as part of this plan that you are sharing in the cost for that. And there's a bigger stop loss component on the entire group as a whole. Being part of this gives you access to competitive, predictable rates. And the pricing on this, as we'll talk about in the underwriting section, is going to be based on the health status, but you can have peace of mind that because of the law of large numbers and the economies of scale here, they are more predictable. When you have just 10 people on your plan, one significant chronic condition can outweigh the amount of premium that you're paying. So when you have thousands on your plan, it is much easier to predict what the future expenses may be, and it's more levelized. That big chronic condition isn't going to be as much of a hit for your individual claims fund. With that also being said, you do have access to the Anthem network, which we all know is a fantastic network, the biggest network in Virginia with the most in-network providers. So a lot of benefits here. So in terms of the benefits, I've kind of talked through a lot of these, but lower cost rate. So if you are an employer and your employees are on the healthier side, you'll likely see lower rates for this type of plan. The rates are going to be similar to what a large group is able to get individually, a group of several thousand employees. Flexible benefits. So as I talked about, we have 146 different options. Stable costs, so predictable costs going forward. Additional savings we'll talk about. Tracy's going to share that with you. There's additional bundling discounts. So if you offer dental and vision currently, there's going to be the opportunity to bundle it with this type plan, and essentially get discounts off of your medical going forward. There's simplified administration and the big Anthem network. You see anything that you'd want to add to what I just shared, just on the bigger picture here?
Sorry, trying to come off mute, Ritter. No, I think that's perfect. You covered it all, and just making sure we know that they have plenty of plans to choose from, and definitely something comparable to what they currently have, and the largest network. So no issues there. Perfect.
All right. So thank you, Tracy. So who can participate? So there's not a lot of not a lot of restrictions here, but I do want to kind of talk about who can participate. Must be a member of a participating chamber of commerce or an affiliated association. And as I mentioned at the top of the call, being a member of HBAV gives you access to the plan because HBAV has joined as a WiseChoice Healthcare Alliance member. So they're an affiliated association. You do have to be an employer with between 2 and 50 employees enrolled in your medical plan. And there's not a lot of flexibility there. So again, we won't be able to do it, unfortunately, for sole proprietors, but we will be able to do it for for those between 2 and 50. And your corporate headquarters do have to be located within the Anthem service area. Now, that covers most of the state. Where it gets there's a little bit of a difference is up in Northern Virginia. And so in Northern Virginia, essentially east of Route 123 is Care First territory. And so if you're east of Route 123, you would not be eligible for this plan, unfortunately. But worth having a discussion with us, because there may be other ways that we can certainly help you, bring down your costs. Tracy, any other restrictions I'm missing there?
No, Ritter, I just want to say that if anyone is on that 123 side, in the Care First, please just always keep that an open conversation, because possibly we could get a seed from Care First. So just reach out to Ritter if that is an issue, because we can work through that sometimes. So
That's a good point, Tracy. So it's not it's a rule, but it's not always a hard
right.
and fast rule. There are some exceptions that are often given, even if you're east of 123.
Right. And Ritter, there was a question. I don't know
Yeah.
if you're able to see it because you're sharing. So you did answer, someone asked about the participants. Is it 50? Yes, as he mentioned there on that slide, 2 to 50 employees. And then there's another I just saw pop up. If we have 2 owners and 1 employee, so 3 plus families on our plan, does this meet the 2 to 50 employees? You just can't employ more than 50 employees. So yes, as long as you have under 50 employees, you would be eligible. And Ritter can work through that with you and
Yes, absolutely.
get you a quote. And he's going to go through some more details. I was just letting you know that question. Continue on, Ritter. Great job.
All right, thank you. So from an underwriting perspective, want to talk a little bit about, and these are not unlike, if you're with Anthem or you've, looked at, other carriers, Anthem, United Healthcare, Aetna, these are similar kind of, restrictions. But the minimum participation is you need at least 75% of your eligible employees to participate, excluding valid waivers. And that's the important part, where Anthem is a little bit different than other carriers. So what I mean by that is, if you have 10 total employees, but 5 of them are either ex-military and they're on TRICARE plans, they're on a spouse plan, they are still on their younger employees and they're still on their parents' plan, those are all considered valid waivers. So if 5 of them are on valid other types of insurance, it brings your total eligible down to 5 out of the 10, and you need 75% of that number. So 75% looks like a daunting, number to hit, but it is really, very accessible. And if you're with Anthem now, or you're with United Healthcare, you're likely already meeting those participation requirements. Pre-existing conditions will be covered under the rules here, and this is going to be similar to the Affordable Care Act plans. They do have to be covered, but as we'll talk about next, the rates, if you have some pre-existing conditions or chronic conditions, the rates may be higher, but still worth exploring, because what you may be considering a chronic condition may not be a big deal from a pricing perspective. So still worth going through the exercise here. The rates provided will be composite, which is 4-tier. So in the old days of health insurance before the Affordable Care Act, where you have employee spouse, employee child or children, and then family, those are your 4 tiers. Those are the type of rates that you're going to receive for this plan. So you may be on a plan, if you're on the call and you're under 50 employees, you may be on a plan through the ACA that is age banded. So this is a little different, and that can be certainly, there's some winners and losers from a pricing standpoint when you convert from age banded to composite rate. But we're quite skilled at helping our clients through that process. It is significantly easier from an administrative perspective to just have 4 rates to worry about, 4 rate tiers to worry about, rather than an age band for each person on the plan. And we can help you with kind of the strategy of how to convert that to make sure it's equitable for all employees. Now, what's going to go into the pricing is there's several different factors. So medical history and expected future claims cost. So they're going to look at, what kind of situations you may have had from a health perspective. And really what they're more concerned with is what are the future costs. So if there was a complicated pregnancy, but that is all resolved, then that is not a future cost that they would be worried about. They're really looking at kind of from this point going forward for any chronic conditions. Age and gender of the employees, number of people enrolled, where your business is located, based on the Anthem discounts. Their discounts are strong pretty much everywhere in the state. But there's some areas where they're able to negotiate slightly better discounts. The pricing may be different there. Which benefit plans you're offering out of their plan portfolio of plans, and then the SIC code. So that does come into play, the SIC code of what the nature of your business is and what they may, expect based on that demographic. I also want to point out that the additional product dues fee is $8 per employee per month, and this would be billed separately by Anthem. This is not something that goes directly to Home Builders Association of Virginia. This is not different than any other WiseChoice Healthcare Alliance group that participates. This was set by the WiseChoice Healthcare Alliance as a separate administrative fee that helps support their effort from an administrative, perspective behind the scenes. So that is a separate fee that would not be built into your rates. Going forward, there are going to be 2 renewal months, as you'll see down at the bottom of the screen. You're going to have a September renewal month, so September 1st and March 1st. So depending upon where, what your renewal date is now, that will determine what your renewal date will be going forward. And so, if you are a May 1st effective date or for your renewal coming up, then you will be assigned the September 1st renewal date going forward. And Tracy, correct me if I'm wrong, but this would be potentially more than a year so this is not going to renew. If they go in May 1st of this year, it's not going to renew September of 2024. It's going to renew September of 2025. So you could, if you explore this and your rates are attractive, you could potentially have much more than a year of, locked in rates for this situation. Let me see. I think there's some things coming in through the chat.
I tried to answer, excuse me, I tried to answer most of them. There are a couple that we probably need to talk about at the very end, just some more detail.
Okay, sounds good.
Okay.
All right, so Tracy, do you want to chat a little bit about the member experience that would be included with Sydney?
Yes, absolutely. I love to chat about Sydney. So if you do decide to move to WiseChoice Healthcare Alliance and you become an Anthem member, the first thing we like all our members to do is to download the Sydney app. This really is the front door to your experience with Anthem. Once you download that app, you can actually get a digital ID card on the app. So you have your ID card with you on your phone, 24/7. And these days, most people always have their phone more so than their wallet most times. But once you download that and you have your ID card, there's multiple things you can do on the Sydney app that, as far as finding care, where you want to get treatment, locating a PCP, there's a symptom checker. If you're not feeling well, you can actually go through the symptom checker, and then you can actually do a virtual visit through your Sydney app. In some cases, no cost to you for doing a virtual visit through the Sydney app. You can look at claims. You can refill prescriptions through your Sydney app. We also have community services now on the Sydney app for any food or shelter needs that anyone might have, and it will help point them in the right direction for that. So the things that you can do right on the app. So definitely always recommend downloading that. So that's a free service. I'm going to get to the next slide. And did you want to talk to us as well? I think you're on mute, Ritter.
Yeah, I would love, if you don't mind sharing a little bit about the, the bundling discounts, because this is a great, great feature to, we're talking about the potential for, significant savings for members on the health insurance side, but there are ways to certainly, bundle dental and vision that are typical benefits as well that they could help them lower the overall cost.
Right. Yeah. So as Ritter mentioned, earlier about that bundling savings. So a couple things here. If you currently have a fully insured plan today with any carrier, as you know, in the ACA world, you can't do any kind of discounting on your medical rates because of the Affordable Care Act. So under the WiseChoice Healthcare, if you add dental and vision to this plan, you can actually get some savings up to possibly 3% off your medical rates. You would also get some bundling discount on the dental and vision as well. So sometimes, in a smaller group, that savings can almost pay for a vision plan. But in the dental and vision and medical all bundled together with Anthem, that lets us see your whole health together in like one snapshot, basically. It's a complete view of a person's health. For instance, like a lot of times if you go to a dentist or a vision provider, they can diagnose medical conditions through that visit. So many times other conditions are caught through those providers. And those systems within Anthem talk to each other. So in other words, if I go to my vision provider and they see something in my eye exam, they'll make a note of this, and through our system, my primary care, my PCP provider would be able to see the notes that eye provider had put in there. So that's all through what we call our whole health connection. So as Ritter mentioned, that's, if you're going to take a look at the WiseChoice, definitely whether you work with Ritter or you have your own broker. I know someone else made a comment in the chat that they have an existing Anthem fully insured, and we'll talk about that at the very end if you're already with Anthem. But definitely quote the dental and vision when you're quoting this plan so that you get the full effect of what kind of savings you can get there.
Thank you, Tracy. And the network is fantastic for dental and vision, just as it is for the health insurance. I do want to just, I thought it'd be worth, in the chat, Katie had mentioned that you have employees in the Charlotte, North Carolina area. Katie, what we would do, and this would apply for anybody that has out-of-state employees, we would put in the Key Care PPO network. And often what we would look to do is have either everybody on the Key Care PPO, because that's a national network, so there is coverage for them. But within the state, you could choose to either have the Health Keepers network for those that are in Virginia, or they would have access to the Key Care as well. So having employees out of state does not remove this from an opportunity for you. All right, so what does it look like to quote? And so this varies by the size of your employee base. So employers with 2 to 9 employees, either way, it's very very easy and streamlined for you all. But with 2 to 9 employees, we would need a dependent level census. And I'll give you my contact information at the end of the presentation. But dependent level census, I can send you a template for that. Your current plan summaries and pricing, so we know, who's participating and what your rates are, currently, your renewal if it's available. And then we'll need individual health questionnaires completed for, all the employees. Now, this is a PDF that can be completed. And that what I'm doing with many other HBAV clients that have already started to explore this is having the employees email those back to me directly to preserve protected health information, so that they don't have to email that back, and then you don't have access to that file. It protects you all from a HIPAA perspective, and you don't, there's not a need to violate the PHI there. From there, we request a quote. The individual health questionnaires just give Anthem an idea of what medication is being taken, what conditions you may have, what surgeries you've either had in the last 5 years or hospital admissions, or what you have planned going forward. It just gives them a better idea of the full picture. If you have 10 to 50 employees, it is very similar with one change. We're still going to need the dependent level census. We're going to need the current plan summaries and pricing, the renewal, but instead of individual health questionnaires, we would request the group administrator to complete a group risk profile, which is essentially the individual health questionnaires, but for on a group basis. So as the administrator, what do you know? What have you been officially notified of? The conditions that your employees have had or will be having. And it's just kind of a broad idea of what you're aware of. But you are not, what we are absolutely not asking you to do is go to each of your employees and ask them to give their, their personal health information to you so that you can complete this. This is just, as the administrator, what you're aware of. There's no need to ask the employees individually from that perspective. All right, so that is the overview that we had planned, and we wanted to preserve a little bit of time. You'll see my contact information is down here, my cell phone number and email address. And Craig will be sending this out. Would love to open this up for questions that anybody may have.
All right, we've got several in the chat, and I'll just start from the beginning, make sure we answered them all. The maximum number of participants is 50, and Tracy answered that. Yes, it is 2 to 50. Nancy
and Craig,
asked,
just if I can just expand on that just really quickly. While this plan, if you have more than 50 employees, while this plan may not be a fit for you due to the size requirements, Anthem also does have a balance funded plan that is a similar setup, it's more on an individual group basis, but there are certainly ways to save significantly there and get control of your overall costs if you're a healthier group. So even if you're more than 50 employees, still worth having a discussion.
okay, great. Let's see. Nancy asked about the 2 owners and 1 employee, and I believe the answer is yes. Tracy, did you want to comment any more about the ownership question? I believe you said we could talk about that at the end.
I think she asked something a little bit further down, so I wanted to clarify. I think she was trying to say there's 2 owners, and Nancy, feel free if you're still on to come off mute, but there are 2 owners and 1 employee. So if the owner, I guess where it seems confusing, some people, and I saw someone else ask about an owner versus an employee. If the owner is, working for the company 30 hours, and they're on vaguely payroll, because some owners don't appear on a VEC all the time, but they're taking some kind of money, maybe a dividend from the company. As long as they're working 30 hours and they want the insurance, you basically have to have 2 to enroll. So if those two owners are on Medicare, or those two owners don't work, or those two owners are covered through their spouse, and you only have the one employee needing the insurance, as Ritter said, you have to have two enrolled to have the coverage, if that makes sense. And I hope, Nancy, come off mute if that didn't answer the question. Thanks, Craig.
So as long as your owners are employees, because a lot of businesses have owners that don't work in the company, they just own a share of the company. So as long as they're employee, they show up on that VEC report. Okay, looks like our company currently participates in a fully insured small group Anthem plan through a local broker with very little administrative burden. Will that change if we move to the self-insured WiseChoice plan?
So, Ritter, did you want me to take that, or
Sure.
do you want
Yeah.
to?
Yeah.
So if you're an existing Anthem group, obviously you can do what we call a conversion to the WiseChoice. You would work with your current broker or Ritter, whoever you work with, and because I basically do new, so you would work with them and they would work through that conversion if you wanted to get a quote. As far as administrative, it's going to work very much the same as what you're accustomed to today. Also, with the WiseChoice Healthcare Alliance, you get benefits from a company called Consolaplex that they're working with for like Cobra and some additional benefits. So Ritter could get more in the weeds with you on that, or any certified broker. If you have a broker you're currently working with, they have to be certified to sell the WiseChoice Healthcare Alliance, which Ritter is, of course. So hopefully that answers.
And just to add to that, yeah, very, very little change from an administrative perspective. Because you'd be joining a larger group similar to the Affordable Care Act pool that you might be participating in currently. Lindsay, does that, if you're still on the call, does that answer your question?
It does. Thank you very much.
Sure.
Yeah, and maybe to add to that, or for anybody else on the call to make it clear, just because you're part of the WiseChoice Healthcare Alliance, you're still going to have a bill from Anthem. You're still going to have a group number. You're still going to have an ID card. You still will have those same similar, everything like you do with a fully insured. You're just part of this larger group pulled together. That makes sense.
All right, there was a question on waivers. What's a valid waiver? See, Tracy answered that. Anyone covered by a spouse's insurance or on an individual plan, on Medicaid, or on their parents' insurance plan, that is a valid waiver. Okay, question about we have someone who has a lot of employees in the Charlotte, North Carolina area. So how is that handled?
And I had mentioned that during when I saw that come in, but you would still have access as long as the employer is the corporate headquarters is based in Anthem's territory. Even with employees outside of the state or Anthem's territory, you would still have access to care through the Key Care PPO network.
Okay,
that
great.
would be important to discuss, when we're quoting, so we make sure that we put in that PPO.
That's what's nice about being able to have those multiple plans. It's not just one plan.
Right.
Okay. Tracy answered James' question. The employer is required to pay 50% of the employee-only cost, the lowest, the base plan. Susan says they're under the new Virginia marketplace. Do you have to wait for the next open enrollment? And they have employees in New York. I'm assuming that'll be the same thing as the Charlotte question.
Yes, that would be the same thing. So, Susan, I guess my question would be: are your through the Virginia marketplace, your employees are getting individual coverage? It sounds like through that marketplace. You do not, in that case, necessarily have to wait for the next. You're able to cancel that insurance at any time. What you may want to be careful about is deductibles that they may have had, they've already partially met. from that. So just being kind of, cognizant of if somebody has had a surgery and already met their deductible, going on to this plan, while you can go on to it anytime, you would need to essentially restart that deductible depending upon the type of plan that you chose. And in New York, absolutely eligible using that key care PPO, because that is a national network. So no matter where you are in the country, you would have access to that type of plan. Does that answer your question?
I believe she said yes, it does.
Okay, sounds good.
All right. And then a question about really how it's underwritten, I guess how premiums are determined. Uh, it's the same premiums are not for the entire larger group, but for the individual company itself. Is that correct?
Yes. So
I think,
individual.
yeah.
Tracy, do you want to touch on that?
No, go ahead. I think he was confused that it wasn't like they're rated individually, but go ahead, Ritter, you got it. Go ahead. That's what he's asking.
So yeah, so the premium, so there's certain factors there that would determine, essentially there is a base level of type of rates that you may have, and then a factor that's applied based on the health status of that individual group. So there are sets of rates built into the plan, and you would be assigned a set of rates based on the health status. So it's not completely individually underwritten, but it does vary. It's not everybody in the entire plan will not have the exact same set of rates. Patrick,
right.
does that answer your question there? Are you?
Yeah, I think so. I think you're saying that there's across this whole broader group of the thousands of people who may sign up for this, there's some sets of rates, and then those are adjusted based on per company based on the people there in these surveys that you're asking for.
Yeah, so let me give you an example. So let's say the base rate is $400 for an employee only. They may have filed a rate if you are more risky as a group. Your employee only rate may be 420 or 440 or 460. Or if you are better than average health status, you may have 380 or 300. So there are filed rates based on the or the aggregate health status of each employer group. Tracy, am I missing anything there with that explanation? Okay. So and Patrick, I'm happy to connect with you offline, and we can chat a little bit more about it, just based on your your individual group.
Okay, yeah, thank you.
Susan, yes, the question. So the first step would be to reach out to me, and we can talk about kind of what you're currently doing, and what what may be applicable for you, and then I can send you the forms depending upon how many employees, as we talked about in the underwriting section or in the quote section. Depending upon how many employees, either send you the individual health questionnaire to have your employees complete, or the group risk profile and the census template. But that would be the first step there.
Okay.
Are there any other questions that folks didn't put in the chat that you had based on our discussion?
I have 3 questions. Out of the 146 plans, is that all Anthem plans, or there are other carriers?
They are all Anthem plans, because this is a plan, Margie, that's being sponsored by Anthem. So they're all using the Anthem network. They are split between the Anthem Key Care PPO network
Mhm.
and the Health Keepers network.
Okay. And then for the healthcare questionnaire, when new employees come on board, do they need to fill out that questionnaire before they get enrolled in the plan, or is that just an initial process?
So, Tracy, I'm gonna take this, and you tell me if you know, we haven't experienced this yet, Margie. But my expectation, my understanding would be that, just like any other level funded plan or self-funded plan, the individual questionnaires help them set the initial rates until renewal. Okay, and then for any new employees, they come in at that already set rate level. At renewal, then you're given based on now this new group. So if you have 4 employees and now at renewal you have 6 employees, they would look at the health status of those 6 employees because they now have claims data for you and assign you a renewal rate. But you would not, Tracy, unless do we need to fill out the individual questionnaire for new employees, or was I correct with that?
So you are correct, Ritter, on that. Just to be clear on at time of enrollment, because sometimes you'll have an employee meeting and you might get the questionnaires for 5 employees, and then there's a new hire added prior to the group getting set up. So if you're doing a 6-1 and you hire somebody on 6-1, when the group comes in for enrollment, everybody has to have been underwritten. But to Ritter's point, yes, after you are set up for a 6-1 effective date for that whole year, anybody you hire in there, they do not have to fill out the individual questionnaire. The group is looked at prior to renewal, and as Ritter says, when you get your renewal. So just at the time of enrollment, everybody needs to be included in that, either on that group risk or that individual questionnaire, depending on the size of your group at time of enrollment. Yep, perfect.
Okay, thank you. Last question is, does WiseChoice also offer workers' comp?
It does not. This is a healthcare only
Healthcare.
alliance.
Okay,
So it's
yeah,
just for
and
health insurance, but we do have opportunities within HBAV insurance to help with workers' comp.
great. Thank
yes,
you. That's all my
Margie,
questions.
if you'd like, you can email me or reach out to me, or I'll follow up with you since you registered. We do have access to workers' comp plans for our members.
Great. Thank
If-
you.
Kelsey, I see in the chat, do you have an idea of how many businesses across Virginia have started the process for this plan? We've got 2 or 3 that have already started to quote it with HBAV. Tracy, this is a very new plan, right? We're in the infant stages of this, but so far, how many do we have that are participating?
So March 1 was the first effective date. So I don't have my total count on March. I want to say March was very slow. We had like 2 because we were so late and we were actually really after a deadline when we introduced it. But I can speak to April. So for April 1, we have 5 groups on the books under WiseChoice. 3 of those which were new to Anthem, and 2 were what we consider conversion groups, meaning they were fully insured groups with Anthem and moved over to the WiseChoice to the level funded. And for five, that was April 1. For 5-1, we have, I've lost count of how many we have in the queue right now that have gotten final underwriting and are doing the paperwork to enroll. So they're coming more and more on board. And I think each month it will pick up because it is a new process.
So
But
Kelsey,
yes,
overall, the
so.
general interest is very high in exploring this, and have seen, quite a few that have evaluated it, have seen significant savings. I would expect that, also a lot of employers that are in the 2 to 50 tend to be either 11-1 or 12-1 renewals. So in this time period of the year, it is lighter on renewals with smaller groups, but I would expect that the general interest level just continues to increase here, because we're not the only association that has been really wishing for an association health insurance plan. This is something that has been needed for quite some time, and there's a lot of different associations that are also participating.
Okay, any other questions? Well, those were great questions. And I want to thank Ritter and Tracy for doing a very thorough overview. Again, this is going to be recorded, and the next steps, yes, you can reach out to Ritter directly. I know he had his information up. We'll also email it back out if you'd like. It's on our website. You can reach out to HBAV. Any of our staff members can point you in the right direction on this. But yeah, I encourage everybody to get a quote. You never know. There's really no risk here other than a little bit of administrative support. But again, I appreciate everybody logging in here, and please stay in touch. And thanks for being a member of HBAV.
Thank you all.
Thank you so
Have a good
much.
rest of the day.
All right.
Thanks, Ritter. Thanks, Greg. Appreciate it.
Thank you.